So as you can see there, we're live on YouTube. So we're streaming this both through the Zoom reservation system and through our Facebook stream as well. And Tara, if you want to go ahead and start admitting the waiting room, that'll be just fine. Excellent. Hello, everyone. Welcome. Hope you'll bear with us for just a moment here as we invite you all in from our virtual waiting room. It'll take just a moment as we bring you all in, and we'll be muting your microphones as you come in this evening. Welcome to the Oklahoma Center for the Humanities and tonight's event. My name is Sean Latham. I'm the director of the center, and it's a pleasure to welcome you. This is a slight bit of a process as we bring everyone into the room. So we'll ask you to just be patient for a few moments, and we will get started just a minute or two right after 7 o'clock so that everyone has a chance to get their Zoom set up and working. We're all old hands now at using Zoom for these kinds of events. In fact, like I imagine many of you, I spent most of my day in various Zoom meetings quite similar to this one. This is our first event at the Oklahoma Center for the Humanities this spring semester, so it's a pleasure to have you all here. It's great to see so many names I don't recognize, as well as some of our more familiar attendees. It's always a pleasure to welcome you to the Oklahoma Center for the Humanities and for the themes that we're working on this year, rage and courage. I think you'll find tonight's talk particularly timely. Like everyone else, just before we admitted you all, we were talking about things like COVID testing and healthcare in the United States. So we're eager for what will be an exciting and compelling conversation this evening. All right, now that it's right at 7, I'm going to take a few minutes to just welcome you and tell you a little bit about the Oklahoma Center for the Humanities as more people continue to filter in for this evening's event. As I said at the outset, my name is Sean Latham. I'm the Pauline McFarland Walter Professor of English here at the University of Tulsa and the director of the Oklahoma Center for the Humanities, which is the host for this evening's event. The Oklahoma Center for the Humanities, for those of you who don't know, has two essential missions. The first of which is to gather together experts from our campus, including faculty and students, as well as from the community, and draw that group of people together to work each year on a theme or a topic that we think can only be fully and richly addressed using the distinctive tools of the arts and humanities. Throughout the 2020-2021 academic year, we've been exploring two themes. That's a first for us. The first is rage and the other is courage. We felt both of these spoke powerfully to the current moment in which we found ourselves. And I'm sure like me, you're finding yourself experiencing both of these emotions on an almost daily basis. In addition to gathering together this group of experts on campus, whom we call our research fellows, and they get together once a month throughout the year and work as an interdisciplinary team to produce research and to engage the topic in a broad and interdisciplinary way. The center also tries to host between 30 and 35 public programs each year. In the past, this has included everything from art exhibitions and dramatic performances to musical concerts and talks like the one that we're hosting this evening. Obviously, the COVID pandemic has required us to throttle back our programming a little bit, but we're also finding some really exciting consequences of that, one of which is we're able to reach a much bigger and broader audience with these digital programs. And so I want to welcome you to the first program for the spring 2021 semester that we're hosting this evening. Before I introduce tonight's program formally, I do want to give you some sense of some of the other events that we have coming up here at the center. Beginning next week on Thursday, and we do almost all of our programming on Thursdays. So on Thursday, February 4th at 7 p.m., we're hosting an event called White Rage, again, an extremely timely event. And that will bring together two experts in the field of civil rights and the history of civil rights, Robert Jackson here from the University of Tulsa and Julian Hayter from the University of Richmond. And together they'll be talking about a book by the historian Carol Anderson called White Rage, The Unspoken Truth of Our Racial Divide, with the underlying thesis of which is that for every advance in civil rights throughout American history, and especially since the Civil War, there has been an equal and almost equally powerful counter response from racists and white supremacists in the United States, leading to everything from Jim Crow to the kind of voting restriction laws that still cause so much difficulty today. So Doctors Jackson and Hayter will be talking about this book, and thanks to a grant from the Tulsa Race Massacre Commission, we're also able to make copies of this book freely available to those of you who might be here in Tulsa. And all you need to do to get a copy of the book is to go visit Fulton Street Books here in historic Greenwood in North Tulsa, the site of the massacre, and books are freely available in that Black-owned and operated business. So we hope you'll take advantage of the opportunity to both get this book and to lend your business to Fulton Street Books, and then join us for a conversation of its compelling and controversial thesis. 2 weeks after that, on February 18th, we'll be hosting Elizabeth Utka, also coincidentally enough from the University of Richmond. She's an expert actually on artistic responses to the Spanish flu pandemic of 1918. And she'll be joining us for a talk about artistic responses in both 1918 and 2021 to the pandemic. We have a number of other events that are coming up this semester that you can find more information about on our site, humanities.utulsa.edu. We've got programs, for example, on art and activism at the southern border. We have a conversation that will function as a kind of survival guide for young people trying to think about climate change. And we're pairing the event on white rage next week with one called Black Rage, where we explore Tiffany Cooper's book about feminist Black rage in the spring, much later in the spring. As again, you can find all the information you might want about these programs at humanities.utulsa.edu. At that same site, you can also sign up for our newsletter, where you'll get regular updates about events at the center. You'll learn more about the work of our fellows and also get suggestions for additional reading and materials that will help support the programming that we do. Throughout tonight's program, you should, as I'm sure you noticed when you came in, we're muting your microphones, but we want to encourage you to participate as actively as you can in the chat, which you'll find if you're unfamiliar with Zoom. Just hover your mouse over the screen, and at the bottom, you'll see a button called chat. If you click on that, it'll open up a window to the right. And we encourage you to ask questions and to make comments throughout the entirety of tonight's event. One of the great things about Zoom is that you don't need to wait to the end of a program in order to raise your hand or make a comment or have a question. We urge you to just pop those questions in there right away. There are several of us here at the center that will be monitoring the chat throughout the evening and consolidating those questions so that we can bring them together for a conversation at the end of the evening. And in fact, as we get going here, I'd like to invite and indeed encourage all of you to just take a moment to introduce yourselves in the chat, tell us your name, where you're from, and what might have brought you to tonight's event. We find that though it's very difficult for us to gather in moments like this because we need to physically distance, this does create an opportunity for community and connection. So please take a moment to introduce yourselves in the chat. And as you do that, I would like to welcome tonight's speaker. And in fact, what I'm going to actually do is welcome one of our current fellows at the center, who will be the moderator for this evening's event. Professor Isla Haas is from the University of Tulsa's College of Law, where she teaches courses on Indian and health law. Before coming to the University of Tulsa, she actually worked as a staff attorney at the Centers for Disease Control and Prevention, where she worked on issues of access and equity. While there, she worked with tonight's speaker, Montrese Ransom, and immediately recommended her to us as someone who could speak powerfully to the importance of courage at this moment where we grapple with the racist structures that are embedded within our healthcare systems, structures that the recent pandemic have laid painfully bare to all of us, I think. As I said, Professor Haas will moderate this evening's event, and she'll also give you some larger sense of the conversations and debates that have been occupying the OCH Research Fellows throughout this year. Professor Haas is a member of the Courage Seminar and has been an invaluable asset for us at the center as we've been working through that topic. So at this point, I would like to both welcome Isla as the moderator for this evening's event and turn the program and my screen here over to you. And thank you, Isla, for agreeing to do this.
Great. Well, thank you so much, Professor Latham, and good evening to everyone. I am really delighted to be moderating our program, which is called Dying to Belong, Racism, Public Health, and the Law. But to be honest, I'm even more excited to have the honor of introducing our speaker, Montrese McNeil Ransom. Montrese is an attorney, a public health practitioner, a belonging strategist. I could spend the entirety of our program talking about her many accomplishments, how she launched her public health career as a prestigious presidential management fellow. I could discuss her long career at CDC, where she advocated for the use of law as a public health tool at every corner of the agency in every corner of this country. I could talk about her countless number of presentations, awards, publications, her forthcoming book. I could do all of that and be delighted. But instead, I want to introduce you all to the Montrese as I know her best. Montrese was one of my supervisors during my time in practice at CDC, but more importantly, she was and continues to be a friend and mentor to me. As I navigated my early days of my career as a public health attorney, my early days in my career in the academy, and now even with a few years under my belt, still reach out to her for her advice and expertise. And she's not just generous with me. She's been generous with externs, fellows, students, taught them how to launch their own careers, how to overcome the institutional and structural barriers that have been put in place to keep people from accessing the highest echelons of policymaking in both law and public health. I watched her be an incredibly fierce and vocal advocate in the context of diversity and inclusion at the CDC and at our profession at large, even when doing that meant that she might be compromising her own opportunities and careers, because she had the courage to put herself out there so that she could support and raise everyone else along with her. And she's also has been an advocate and continues to inspire me on using law to not just practice, not just regulate, not just advance policy, but using law for what it is meant to do at its very core, which is to eliminate health inequities. So Montrese, I'm delighted to host you here virtually at the University of Tulsa, and I am happily going to pass the baton over to you and continue to be enlightened and inspired by you.
Thank you, Isla Haas. You weren't supposed to make me cry. Thank you very much, and thank you to all of you who have joined today. I am going to share my screen while I try to wipe a few of these tears away so that I can present in a cogent fashion. So I like to start any presentation or speaking engagement that I'm doing on belonging out with a story. And so I remember very clearly waking up on a Friday morning, and instead of rushing me through breakfast and out the door to school, my mother sat me down between her legs and she began to do my hair. What's important to know is that, typically she'd do my hair on a Sunday, and that hairstyle was meant to last all week long. So I knew something was going on with her not sending me to school and doing my hair on a Friday morning. I remember her hands, this beautiful shade of chestnut brown, parting my hair down the middle, and I could feel her hands slightly trembling. And, usually when she would do my hair, she'd be chatty. What's going on at school? Did you make any new friends? What's 2 times 58? But in this particular moment, she was noticeably quiet. And then she goes and gets me my Sunday dress, like the Sundiest of Sunday dresses, all frilly and pink. And my little 4-year-old, 5-year-old mind was really confused. What's going on here? We're not going to church. She's not taking me to school. What's going on? Well, that was the day that we married Lewis Mack McNeil. And when I tell that story, I always say we, and I talk about it like our wedding, our ceremony, because they always made me feel like we were a team of 3. We held hands in the front of a tiny brown church in a tiny town right outside of Fort Polk, Louisiana, and we took our vows for better or for worse, for richer or for poorer. And I remember walking out of the church hand in hand to my mother's 1976 Pinto pony. This was a long time ago. And I sat in the back seat on the ride home, buckling and unbuckling my patent leather Mary Janes, knowing something important had just happened. I looked in the front in the passenger seat at my mother, and I could see her glowing as she kind of fiddled with the 8-track player, her 70s Buffonti hairdo going on. And she was smiling. And I leaned my little pigtailed head between the seats, and I looked to my left at Mac, this 6-foot-tall man, his head literally almost reaching the roof of the car. And I look at him and I say, I can call you Dad now. And I see this smile appear right below his bushy mustache. That was my first lesson in belonging. About a year after that, Mac legally adopted me. And then about a year after that, I remember getting my first school yearbook. And some of you may remember getting that yearbook and flipping through the pages, dying to find your picture. And I remember that day, and I found my picture and I saw my name. It said Montrese Williams. And I remember a flood of disappointment coming over me, and I screamed, I'm a McNeil. I took out a Sharpie marker and crossed it out. I knew, even at that young age, that the yearbook got it wrong. I was a McNeil. That was the name of the family that I belonged to. And that was an early lesson for me that belonging, a sense of belonging, is something that we must create for ourselves. Now, I do a lot of public health work, as Isla mentioned. I am a lawyer, and I'm also trained as an executive leadership coach, and I do work in belonging strategy. And when I work with individual clients, my goal, my aspiration is to teach them that anywhere they are called or aspire to be, they belong. And when I work with leaders and organizations, my goal is to teach them how to build truly inclusive workplaces where our authentic voices are seen as the value that they are. It's not about culture fit, it's about culture add. And one of the definitions of belonging is to be in the right and suitable place and know it. And I just want you to know that if you're on the Zoom tonight, on the YouTube, you're in the right and suitable place. And my hope is that something that I offer resonates with you, even if it's just one point that you can take with you to help build more inclusive environments, to help build more cultures of belonging in your shared spaces. Some of you may remember Maslow's hierarchy of needs. And he was a 1940s human psychologist, and he said that our needs as human beings fall into 5 tiers, and he put those in a pyramid that you can see here on the screen. And ultimately at the bottom are our physiological needs, so our need for food, sleep, and water. And once we have food in our bellies, we move on to our need for safety, security, a roof over our heads. And once we're full, and once we have a safe roof over our heads, according to Maslow, we move on to the higher order need of belonging. And belonging is so critically important to each of us as humans that we've got to have that need satisfied before we can move on to full self-esteem. And you've got to have your full self-esteem in place before we can move on to self-actualization. Belonging is critical to each of us, no matter our gender, our background, our race, our ethnicity, our heritage, our religion. Belonging is a basic human need that each of us have. Now, I do want to ask you to use the chat box and tell me what you think belonging means. What does belonging mean to you? Let me see if I can get the chat up so I can see some of your answers. As I say the words, as you see the words on the screen there, what does belonging mean to you? Usually when I ask this question, I get feeling valued, feeling at home, feeling accepted, free to be me. But sometimes, actually very often, I get fitting in. And this is a good time to point out that belonging is not fitting in. If I get to be me, I belong. If I have to be like you, I fit in. Belonging is accepting me for who I am and accepting my differences as the value add that they are. Fitting in says, I have to be just like you in order to feel that sense of acceptance. There is a distinct difference. Belonging is also a strong human motivator. It's the reason that we join churches and civic groups and sororities and fraternities. It's the reason that young men with so much potential join gangs. And it can see us do some really interesting things. It's the reason that Rachel Dolezal, who you see on your screen here, a white woman who was born to white parents and raised by those parents, she identifies as Black and actually rose up the ranks to leadership in the National Association of Colored People, NAACP. It's the reason why Jessica Krug, a George Washington University law professor, only recently revealed that she is white after spending much of her career identifying as Afro-Latino. It's the reason why Adewale Akinwumi Agbajabe spent a portion of his youth as a member of a skinheads gang. To be clear, the actor from the television show Lost spent a portion of his teenage years as a member of a skinhead gang in Tilbury, England. He talks about the story in a movie called Farming, where he was fostered off to a white British family, and he spent so much of his youth dying to find a place to belong, looking for a sense of belonging. That when this skinhead gang comes along and takes him in as a pet and really does nothing but humiliate and torture him, he begins to believe that because they are allowing him in their space, he begins to believe that he's actually rising up in their ranks. It's a really amazing movie that shows how strong and how much of a motivator the sense of belonging, this need to belong, can be. Some of you guys may recognize this face. This is John Cho. John Cho is an actor from the Harold and Kumar franchise. And I read an op-ed that he wrote right at the start of the COVID-19 pandemic. And he talked about how when he was a young child growing up, his mother used to make him and his brother watch hours of television so that they could learn to speak and act like a real American. Her hope was that their race, their ancestry wouldn't be a barrier to them in this country, and that if they learned to act enough like a real American, they would feel that sense of belonging. And he went on in the op-ed to talk about how he really did begin to feel a sense of belonging when he became an actor, probably because of all that TV watching his mom made him do. Doors were open to him and he felt like he belonged. And then COVID-19 happened. And there was an onslaught of hate messages and comments against Asian Americans. And in his op-ed, he says, at one point, we are Americans, and at another point, we're foreigners who have brought the virus here. But he concludes that article by saying that he chose the citizenship that his parents chose for him. He is an American. He says he belongs in this country and he knows he belongs in it. He says because he's earned it. But the reality is, not all of us have to earn it. There is an implicit sort of privilege that comes along with belonging to certain groups, populations in this country. That in and of itself is having that expectation of belonging is a privilege, is surprising to a lot of my friends who are not from marginalized communities or people of color. But the way I really look at it is privilege is not the presence of a thing. It's more of an absence. It's an absence of an immediate tension and anxiety when you're approached by a police officer when you know you've done nothing wrong. It's the absence of fear of being someplace and being questioned about being there simply for being. It's the absence of having to spend so much energy wearing a mask. And I don't mean the COVID-19 mask, I mean the covering mask, where you're covering your identity so that you can be more like the group you're with, so that you can fit in rather than try to find that sense of belonging. It's an absence of this default feeling of otherness that many of us in marginalized communities feel in this country. And the reality is, we're in a space right now where it's ubiquitous, it's in the air. And after the murder of George Floyd and the seemingly unending, continuous killing of unarmed people by police officers, unarmed Black people by police officers, coupled with the backdrop of the COVID-19 pandemic, which has had significantly disparate impact on Black and Brown people. All of that has been obstructive to our feelings of belonging in this country. And the reality is, when we look at statistics like this or articles like this that point out that depression and anxiety spiked among Black Americans after George Floyd's death, this is really just an example of disparities that we face in this country. For many of us, we're beginning to realize that simply being an African American is a social determinant of health. But that's something that we've been talking about in public health for decades. It's been said that whether it's police-involved killings or disparate health outcomes where Black American patients can't get treatment because they aren't seen as being sick, or financial redlining in certain zip codes, food deserts, or people of color getting hit by cars more often because their communities aren't walkable. Ultimately, it's all due to racism. And I want to offer you a few more statistics on it. So Black women are up to 4 times more likely to die of pregnancy-related complications than white women in this country. Black men are more than twice as likely to be killed by police. The average life expectancy of Black Americans is 10 years less than that of white people in this country. A baby born to a Black American mother is 3 times more likely to die before his or her first birthday than a baby that is born to a white mom. 7% of white people in this country are uninsured, while in the Black community, the uninsured rate is 30%. And I thought that I would escape some of these disparities by getting my law degree and rising up in the career ranks and making some money. But the reality is, even after class and poverty are accounted for, Black Americans still have worse health outcomes than white Americans. Studies show that the health equity gap is even wider between wealthy Black Americans and their wealthy white counterparts. And I want to make it clear that these health disparities are not the result of poor hygiene, as one Ohio lawmaker and emergency room doctor actually asked. It is the result of the way our country was built. It's the deep-seated racism that is embedded in our courthouses and in our healthcare system and in our schools, even in ways that we don't often see it. And so when I think about these issues and look at it through the lens of belonging, it's all obstructive to belonging. It makes us question whether or not we belong in our homes, in our schools, in our workplaces, on the highways, in a drive-through, in this country. I want to point out that our healthcare system and our legal system and our education system are all staffed by human beings. And I want to point out that I'm not particularly with public health, because I know public health in general, people come to the field of public health with whole hearts and this desire to be altruistic and to change the world. But studies show that all of us in America have bias. If we're breathing, we're biased. And what studies are showing more recently lately is that we need to do more to increase representation, particularly in healthcare. Racism, bias, and discrimination are as much a part of those systems as they are everywhere, because we're human beings. And as human beings in this country, we are subject to the social constructs and beliefs that permeate our society. The Institute of Medicine in 2003 pointed out that one of the key factors behind the health disparities that we see in this country involves the fact that while 13% of the population in 2003 was African American, only 3% of physicians were African American, and they recommended that we increase that. Over the last 2 decades, the numbers have improved. 6% of the physician population is African American. But in 2021, we have fewer Black American males in med school than we did in the 1970s. And I don't think any of us, not even the Institute of Medicine, when they recommended that we increase the number of Black physicians, we're not saying that we need to have the exact number of Black doctors for the exact number of Black patients. But if you look at the article on the screen, it makes a difference. Science shows that an African American doctor can understand more culturally what's going on in the household of an African American patient. The cultural competence is there. They share often lived experiences, so they understand the context of the healthcare advice that's being given and why, or the barriers that may be involved in non-compliance. And so studies show that African American physicians, Black physicians, have better compliance rates from their Black patients when it comes to complying with healthcare advice and guidance. So when I look at this particular article that says Black newborns are more likely to die when looked at after white doctors, this is not a conscious thing that I think white doctors are doing. A lot of it is unconscious bias. And again, if we're breathing, we're biased. I want to kind of bring this point home a little bit. And I want to offer a quick little case study that was developed by a young woman that I worked with named Samantha Bent-Weber. I worked with her in the public health law program at CDC before I left the program. And she was working on this case study, and I want to share it with you because I think it brings home the connection between public health and racism and the law. So I want you to imagine that you live in a small community in the Appalachian region in this country. You live in a small town right outside, or in a community in a small town of Zanesville, Ohio. And your community is located right outside the city center. It's a majority Black community, and your community is called Coal Run. It's called Coal Run because that's the name of the street that you and most of the people in your community live on. Interestingly, your neighborhood, your community sits right on top of a long abandoned coal mine. And you don't have any running water. You have access to a well, but when you go to pull water from your well, it looks like maybe the color of your morning coffee this morning with just a little bit of cream. And so you and your neighbors have to find alternative methods to access safe, clean water for drinking and bathing and cooking. It's 2002. You and your family are still using outhouses. You fight really, really hard to try to get access to clean water. You call up your county commissioner, and your county commissioner says, the community of Coal Run will get water, public water, when President Bush drops spiral bombs and it hits good water. That same commissioner tells you that your great grandchildren would be lucky to get access to public water. So you call the health department. And the wonderful health department public health practitioner says, why don't you just build a well? But you have a well that's full of polluted water from the long abandoned coal mines that sit right on top of your community. And you know, you shouldn't have to dig a well. Your community, the community of Coal Run, which you can see here on the map in the light blue, is literally surrounded by public water lines. So when I start telling this story, folks, immediately say, yeah, well, those poor people, and they were poor. They were absolutely poor. The economic consequences of losing the coal mining industry impacted Coal Run. But the reality is this was a majority Black community. Your community in this case study is majority Black. In 2002, the county, Muskogum County, was 94% white and about 4% Black. If you had to guess where the majority of those 4% Black folks lived, they lived in Coal Run. And so after fighting with local government for 50 years, you and your neighbors decide to file a complaint with the Ohio Civil Rights Commission, claiming a pattern and practice of racial discrimination that violates federal fair housing laws. And after a long time and a lot of money, the commission agrees. And they find that it's a pattern and practice of discrimination that has prevented you and your community from getting access to clean drinking water. Now, I tell this story because it's relatively recent. It wasn't until 2003 that Coal Run received agreement that they were not getting access to public water because of their race and of course because of their socioeconomic standing. And it's also important to point out that they took the steps that we would tell people to take in public health. Talk to your county commissioner. You've got public water lines available. Call your local health department. And they still weren't able to get the help they needed. They had to rely on a legal intervention, reaching out to the Civil Rights Commission in order to improve the health of their community. But the reality is that sort of legal approach is not always the right approach to take. It's not always the safe approach for a community like that to take. First of all, it takes a long time. It can cost a lot of money. And one-off adversarial approaches like that are not always in the best interest of poor, marginalized communities like Coal Run. What this story raises for me, it sort of points out two dimensions of this work we do in public health. And the first are the social determinants of health, and the second is health equity. So when we think about the social determinants of health, think resource availability, healthcare access, public safety, social support, natural environment, work sites and schools, physical barriers, education, transportation, all of those things in our environment that create the conditions that either are facilitators for health or barriers to health. And when we think about the story of Coal Run, it draws our attention to the social determinants of health because it really focuses on the structural, economic, cultural, and political factors that order relationships, that assign social status to specific populations, that distribute money and power and resources. And the social determinants can also build or disrupt communities, as we saw in the Coal Run story. In the case of Coal Run, there were four sort of key social determinants of health at play. The first is their standing as Black residents in their community. The second is this weirdly complicated infrastructure that tells us how we share water across communities and across county lines. And third, the socioeconomic conditions of the community that resulted from the diminished coal mining. And fourth, the pollution that impacted that community, the Coal Run community, as a result of the diminished coal mining industry there. And this story also draws our attention to health equity, this principle that we should all have access to the conditions and the resources that we need to live healthy lives. And in the case of Coal Run, the reason that the community had a strong discrimination case was because, as compared to their majority white counterparts in the rest of the county, they were unable to get access to something that we know is a basic human need: water. And they were subject to inequitable conditions that burdened their pockets and stripped them of a great deal of time, caused them extreme stress, and put them and generations at risk. But I want to point out that there's a third dimension to the story, and that's the law. The law impacts health in so many ways. I often say that the law is a social and structural determinant of health. It is the law that creates the framework that allows healthy choices to be the norm. There are laws in this country that say you can't build community gardens, and that limits people's access to fresh fruits and vegetables. There are laws in this country that continue to push forward this idea of separating and segregation of races in neighborhoods. And today you can literally determine your life expectancy based on your zip code. And as a lawyer, I often question, why is that? Is it because one community has a certain law on the books and another doesn't? Or is it because a certain community is enforcing a law on the books and maybe another community isn't? But when we think about health equity, sadly, stories like Coal Run are not as rare as you think. And discrimination and the bias that we often feel as African Americans is not just impactful to our health and our health outcomes, it's obstructive to our feelings of belonging in this country. There's an old African proverb. This is just a child who is not embraced by the village will burn it down to feel its warmth. And I truly believe that the protests that we saw last summer were a visual depiction of this proverb in real time. Again, with the backdrop of the disparate impact of the COVID-19 on Black and Brown people. It served as, the events served as a reminder to many of us that we don't always feel the warmth of the laws and the legal protections that were outlined in our country's founding documents. And it signaled to many of us that it is time for significant social change. It's time to normalize this conversation around bias because it's embedded in our system. And if we want to see change, and we want to go from bias to belonging, it starts with us as individuals, because we're the individuals in the system. These events also really signaled that we need sustainable foundational change in the system, and that requires policy change. So what is social change? Sociologists define social change as the changes in human interactions and relationships that transform cultural and social institutions. And these changes occur over time, and they can have profound long-term consequences for society. Think women's rights. We get to vote. Think civil rights. Think LGBTQ rights, right? Those are social change efforts that have had profound and long-term consequences on our society. Individuals have changed, mindsets have changed, relationships have changed, generations and cultural norms have changed. through these social change movements. Our country's election of its first woman and first person of color to the second highest leadership role in our country came by way of social change, women's rights, voting rights. Without it, she wouldn't be in the role that she is now. And I truly believe that no matter what your political affiliation is, there is an increased sense of belonging for women in this country, for African-American people in this country, Black people in this country, for immigrants in this country, with the election of Kamala Harris as our first woman and person of color as our vice president. And this is because belonging is necessarily also about representation. It's about seeing yourself in the highest positions in an organization, the highest political roles, on the committee, in the boardroom. My mother likes to say, once you see it, you know you can be it. Representation matters. When it comes to social change and belonging, we can, when we feel like we belong, we feel a responsibility to change the direction that social change is going in. We feel a responsibility to our family when we belong. We feel a responsibility to our community, to our neighborhood, to our country. And when we can accept, although we must accept that change is constant, when we feel like we belong, when we feel psychologically safe, which is what belonging is all about, it's about psychological safety, then we feel a need to come together because we don't feel powerless in the wake of change. When you feel like you belong. When we feel like we belong, we not only feel a responsibility to our families and to our communities, but to the world. And when we feel a responsibility, we want to change and shape the world that we live in and try to create the change that we wish to see in the world. And I don't know who it was who said those words first. I think it was Gandhi. My daughter tries to tell me it was Barack Obama who said those words first. I'm not really sure. I don't think it really matters. I think what matters is what it causes or it's asking us to consider. And that's, what change do we wish to see in the world? As a coach and as a belonging strategist, I'm really on a mission to empower people to recognize that despite what the external environment may say, again, anywhere you're called or aspire to be, you belong. And my goal and my purpose and my passion in this life is to use what I know about public health, what I know about the law, and what I know about people and mindset to really get people to recognize that this is all about self-awareness. Belonging is about self-awareness and your connection to your community. So I want to ask you, what kind of change do you wish to see in the world? In your neighborhood, in your community, in your school? I'd be willing to bet that no matter what it is, it all starts with some sort of human connection. It all starts with cultivating a sense of belonging. And in my workshops, I talk to folks about this idea of going from bias to belonging and how important it is to do it on an individual level. From a little spark may burst a flame. And so I want to walk you through the SPARK model. I want to give you some hints and tips on some things that you can do to create cultures of belonging in your shared spaces. So the first S in the SPARK model is make space for authenticity. As Brené Brown says, if I get to be me, I belong. If I have to be like you, I fit in. I think it's important to recognize that it does take intention and commitment and courage to create environments that are conducive to authenticity and humanity and vulnerability. But I want to encourage you to do it anyway. This may mean using words like culture add instead of culture fit. It may mean the use of gender neutral bathrooms or gender neutral language in job applications or job descriptions. It may mean checking microaggressions immediately when they happen and purposely offering microaffirmations. The next step is the P. That stands for BPC, not be politically correct. Those of you who are in my age group may remember being politically correct was the word of the day, but that's not what this is about. It's about being people-centered. It's about being professionally competent. And it's about being personally compassionate. Because all of us want to be able to show up as our whole selves and do good work. And it takes a lot of energy and masking and covering to fit in environments that aren't people-centered or professionally competent or personally compassionate. The A stands for develop an acceptance mindset. No one wants to be tolerated, tokenized, or othered. This requires that you begin to recognize and open your thoughts to the idea that there's value in everyone's thinking. It requires a deeper exploration of diverse others, getting to know diverse others. There's an article that I read recently that said 75% of white people in this country don't even have a Black friend. You can develop an acceptance mindset by seeking out friendships with people who may have similar aspirations and similar missions that you have, but may be diverse in other ways. The R in the SPARK model stands for encouraging representation. As I talked about, belonging is also necessarily about representation. And it takes courage to center unrepresented voices. It takes courage to look around the room and ask yourself, whose voice is not being heard? Whose voice is being muted? Who's not in this room? And purposely, intentionally bringing them in the space. It took 19 years for me working at CDC in the program that I was working to see another Black person brought onto my team. Because I was the only person normalizing this conversation about representation. No one else really understood how important it was. Finally came to the point where I realized that I had to say something louder. And so I want to encourage you to join me in that fight. We are missing the full spectrum of the diversity of thought in this country as we move it forward when we're not encouraging representation. And so it's critically important that we pay attention to whose voice is being muted and whose voice is not in the room. And most importantly, I want to encourage you to develop knowledge about and work to overcome your implicit biases. As I said earlier, if you're breathing, you're biased. And for many of us, we have biases in many ways that are affirming and positive. I like to say I'm biased toward action. It's a positive bias. But there are studies in this country that show that American citizens across the board are biased against African Americans. And even those folks who express that, and not racist, I'm not calling anybody racist, I want to be clear about that. I truly believe that there is, we feel one specific way, but we act in a different way based on our subconscious. And that comes from the social programming and the beliefs that we have about populations and specific groups of people. And we immediately go to the easy answer, which is the answer that is stored in our brains from things that we've seen, instead of getting to know somebody and working through our own biases to see where they exist. And what happens is, one specific example that comes to mind to me is African American people in particular are underrepresented in the scientific literature. There are studies that show that statistically there's certain really positive words that statistically are used more in performance appraisals for white people than they are for African American people or for Black people. And I don't believe that the people that I work with are necessarily doing that on purpose. I think it's just a bias. And I want to give you a real quick personal story here. So I left the Centers for Disease Control and Prevention in September of 2021. And I left because it was time to leave. But I left because for the first time I could put a name to the feeling and to the behavior that I was being subject to. As Isla mentioned, I'm in the process of publishing a textbook, and I'm super excited about publishing that textbook. And I believe that I may be the very first African-American woman at the Centers for Disease Control and Prevention who's ever tried to do anything like this. White men do it all the time. But there's a certain level of scrutiny that I received that white men don't receive. And I saw it, and white men saw it. It was pointed out to me. And again, I don't believe that the people who were scrutinizing the fact that I was working on this book were necessarily racist. I just believe that somewhere in the back of their head, something just didn't feel right about an African-American woman doing this. When I raise the issue and point out that, well, the white man's getting to do this, they say, well, they shouldn't get to do it either. Maybe we should have paid more attention to what they were doing too. There's this thing about paying more attention. It happens in Black communities with over-policing. So now we see Black folks don't have an issue with, as in compared to our white counterparts with the opioid epidemic. We weren't prescribed those. We're being over-policed for other things in our communities. When it comes to prescriptions from healthcare providers, there's a bias in healthcare providers that say that Black people, and there's studies that show this, that say that Black people are more colorful in the way they present feeling pain. And so perhaps we're not in as much pain as we present. And so statistically, we weren't prescribed opioids. And for the first time in this country, we're seeing the life expectancy decrease for high school educated white women. And drug addiction is now a use disorder. There's bias there. It wasn't a use disorder when it was happening to a specific population and their life expectancy was decreasing. But now we call it a use disorder. It's not a problem when white men publish textbooks and work for the federal government, but we've got to pay attention to this Black woman. It's not a problem that for the last 20 years I've been working in public health, we've been talking about the same infant mortality rates for African-American babies. And we know the science to fix it, but we are not putting the attention on that. It's because we're not going to see changes in our healthcare system until we all check our implicit bias. We're not going to see changes in our legal system until we all check our implicit bias. And primarily, I believe that is because when the policies and the practices are being implemented and written and enforced by people who are so far removed from the people who are dealing with the health disparities and so far removed from the lived experiences, there's no way you can really perceive it in that way. And so it's important for us all to work through and overcome our biases, each and every one of us. And I offer some tips on this slide in ways that you can do that. The reality is that our interests, our motivation, our health, and our happiness are all tied to the feeling that we belong to a greater community that may share a common aspiration, mission. Belonging is indeed the gateway to self-esteem and full self-actualization. And when we feel like we belong, we can come together, like me, my mom, and my dad, and more effectively use our collective power to bring our vision of a better future to life. And with that, I thank you. And I'll turn it over to Isla for moderation.
Well, thank you so much, Montrese, for sharing your expertise, your energy, your personal stories, and framing this in a way that can give us the opportunity to kind of learn and grow. as you're sharing all of this. So I've got a few questions that I thought we might be able to kick it off, and I encourage all of our colleagues that are joining us to put some questions in the chat box as they come up. So the first question I had about this connection between belonging and representation, I find myself, and I know others have said, this idea of promoting diversity, promoting representation, it adds to the community. It brings all of us up. But I think so much of the resistance to change is because of losing something. And that's a lot of times losing power, right? So when we think about, Representative AOC was encouraged not to run for the House because it wasn't her turn, because other folks had done their time. And so how do we deal with this idea of representation as taking something away from folks who have traditionally held the power?
I mean, I think AOC is representation of young folks in power, right? I think representation crosses the board. One of the things that I talk about when I talk about belonging is this idea of diversity. The way we talk about diversity are the things we can see. There is some value to this idea of what's often invisible diversity. We all have a diversity story. And so I sit from this lens of, I would like to see more people like me in positions of power so that I know that I can get there. But young folks want to see more young folks rise to positions of power so that they can see it too. And I think that we've had many, many, many years of white men being able to do that. And it is a little bit time to share the space. There's evidence that shows that we're missing diversity of thought in this country, and it's slowing down our innovation. And so when I think about waiting your turn, I don't believe in that. I believe anywhere you are called or aspire to be, you belong. And I do believe that you may have to build up some thick skin around that and do the work to prepare yourself for it. But representation is across the spectrum, including age, including education, including where folks come from across this country, rural or city, or where you're educated, an HBCU versus a PWI, the regionalism across the board. We want to see representation. I'm proud when I see somebody from Columbus, Georgia doing something. That's representation. So I definitely think that there is an element, and I think a lot of that may come out in the white rage discussion that'll happen soon in this series. And I've done some reading around this idea that it has to be give and take. I believe there's enough for everybody.
Yeah. I have another question. It might be a little bit of a hard one, but maybe it reflects some of my own privilege, but you said several times, well, I'm talking about bias, not racism. Mm-hmm. And I think a lot of times I often will say racism, not bias. Mm-hmm. And I wonder how that relates in terms of communicating and supporting change and growth in terms of defensiveness. And so I'm just kind of wondering. That's
why I've switched my words. I read an article recently, Isla, and folks here, who said that there have been some declarations across this country of racism as a public health issue. Mm-hmm. And there was a recent survey of American population, and like 75% say that racism, that health disparities have nothing to do with racism in this country. There are a bunch of studies where white people are asked and they say they're not racist. They also say they're not biased, but we call it implicit bias because you don't know it's there. And often the implicit bias is the opposite of the way you express. And oftentimes, even when you're the most altruistic and the most heart-centered person, even with all the PCs, professionally competent and people-centered and all of that, you can make mistakes in your language because of our social programming. And it doesn't make you racist. I working with tribal organizations, I used to say, we're gonna have a powwow. And I had to have somebody say, that's not what you're having, Montrese. It's not a powwow. You might be having a meeting, but it's not a powwow. And I had to be taught that. And I think it is also a good kind of point out that I think we're in an era now where a lot of people are calling people out. And I think and there are people who work in the diversity, equity, inclusion space who would say to me, Montrese, you need to call it racism. Don't call it bias.
Yeah.
But the people that I work with are not racist.
Yeah.
I even believe the people who caused me that trouble with the book, I don't believe that they're racist. I believe they're biased. And I believe if they were to take some implicit bias tests, they would see that. No one's asking them to do that, though. No one's asking them to look at their bias.
Gosh, what an easy
That's the
thing that we
problem.
could do.
Say that again?
What an easy thing to do. We have all the tests to demonstrate implicit bias, so why don't we require that?
Yeah, it's a good question. When we're all biased. I mean, the reality is, when I was talking earlier about studies that show Americans are biased against African Americans, it's Black folks too.
Yeah.
We see the same social programming and receive the same messaging as everyone else in this country. It took some work for me to recognize that I too have bias.
Yeah. Yeah.
It takes work.
Yeah. And then to be able to study what it is on the individual level, acknowledge it, and it'll make you more cognizant of it in terms of your interactions. It's really
particularly for those of us who are in leadership roles, because when it comes to, when I was speaking earlier, if all human beings have a level of bias, and science shows that we do, you don't lose that bias when you become a judge, or you become a lawyer, or when you become a doctor. But you're in a position of influence, so that bias has a profound impact on people's lives and their behavior and their actions and their beliefs and their way of thinking, because you're in a position to influence people with that bias, which is why I do think we've got to talk about it as bias. And I want to, again, I had a conversation with a friend of mine who says, it sounds too soft. You need to be calling it what it is. It's embedded racism.
Mm-hmm.
And I do believe that in many of our legal documents and in our policies, there is some embedded racism. Yeah. Our healthcare system looks the way it looks because we had a segregated healthcare system. Mm-hmm. The system isn't broken. It's working exactly the way it's supposed to be working. We just haven't fixed what we found that doesn't work in the new generation, right? So it's working, the whole system is working exactly the way it's supposed to be working. I mean, but if we don't call it out for what it is, we have to call it out, the bias, the embedded racism, but we have to call people in, because we're all human beings. And no matter our race, our gender, our ethnicity, we all want to feel like we belong. And honestly, the way you make you feel like you belong is by helping someone else feel like they belong.
Right, right. The question kind of was motivated from my experience as a non-native Iranian American woman doing so much work with tribes and tribal serving organizations on public health issues, and how I've literally been asked by representatives from tribes to say, come do this training on working with tribal governments and tribal sovereignty and federal Indian law, because I can't say the same things that you do. And if I do say it, it's not going to be received the same way. And so literally folks call me in to be like, when you do this with tribes, that's racism, that's anti-tribal sovereignty. And that somehow my voice is going to have more of an impact when it's not my community and not my rights that are being infringed on.
Because you've studied it. And you've gotten to know the people, and you do your work from a professionally competent, culturally competent, people-centered way. Absolutely.
I try.
But my thought is, like, my heart is like, please, if you're going to be working with this population, go do the work so you can have this conversation.
Yeah.
Go and be honest about the fact that we're all biased. I've worked with tribal communities and have felt a sense of bias from tribal community folks. This is everywhere. We all need to be trained in this.
Yeah. Well, we've got tons of really great questions in the chat. So I want to start off with a question about how can medical professionals of color promote trust in science, or even folks that are not medical professionals of color? How do you promote trust in science in the healthcare system? I think, maybe in line of things like vaccines, treatment, when certain communities have historically, systematically been subject to oppression using the medical system.
Stop subjecting us to oppression. I mean, I wish I had a really good cogent answer for that. I should probably put on my my professional hat, but my Montrese hat immediately says, yeah, no, we don't trust the medical system, and we have every right not to. Every single right not to. I think that, go ahead, Ida.
Well, what does rebuilding trust look like to you, do you think?
I think it looks like purposely taking a look at the demographics of your community. Actually, let me back that up. I think that one of the things that we need to do is hospitals and health systems and schools of medicine need to have and hire and include chief health equity officers, not chief diversity officers, chief health equity officers. Because I think there you can build trust within, you know, the relationship with your patient. And I'm sure medical school talks about how physicians can build relationships with their patients. But I really ultimately believe that this is a systemic issue, that even if you, as an African-American woman, even if you, doctor, present to me with all the right boxes that say I should be able to trust you now, the history is still behind me. My culture is still behind me. It's still there. I need to see changes in the system. So I think that starts in medical schools. I think that we can no longer, in the field of public health particularly, we can no longer talk about minority health in one session. It needs to be talked about everywhere, all the time. If you're talking about COVID, talk about minority health. If you're talking about hepatitis C, talk about minority health, because we have health disparities across the board. I think the more we normalize that conversation, the more trust will be built among the community. I think the other thing is that, sadly, I read this pretty recently. I don't have the book in front of me, but I read pretty recently that there was a study done, and most physicians don't even really understand the significance of health disparities in this country among race. And they specifically say they're not biased. When asked, they say they're not biased in how they treat their patients. But we're finding that that's not true. And so many more hospitals are hiring these chief health equity officers to work with physicians so that they can build up their cultural competency, so that they can watch physicians in the encounter with their patients, so they can better understand why patients of a specific physician aren't adhering to the medical advice from that physician, to understand the reasoning why. There's a lot of work that needs to be done. I will tell you, for me, I got trust in my white physician because he asked about the context of my life. Mm-hmm. He didn't offer medical advice. One of my favorite examples is when we say, you should reduce your sodium intake. Now go home and reduce your sodium intake. But your grandmother does all the cooking, and we're poor, so we only buy processed food, and the physician's not asking about the context in which you live, just saying, go do this. And then based on my experience and conversations I've had with people in my family, we just lie to the physician. Yep, I reduced my salt intake. I did what you said, because that you're in a position of authority. You've influenced me, but I can't do anything to change my context. I can't change the social determinants. Society has to do that. Policy has to do that.
So whether physician or a boss or a colleague, do you have any productive but like safe and gentle ways to call out implicit bias in a way that is, because you could tell someone, oh, I think this, you might be biased, but all they are going to hear is racism, right?
Yep.
So
that's why we've got to normalize this conversation about bias.
Mm-hmm.
That's why we have to normalize it, because when I say it, that is often what people think.
Yeah.
So I've had to do this a couple of times, and it's not easy. And so I want to say what comes to mind immediately. We have to call out the microaggressions. I have literally watched someone who worked for me expend 60% of his energy trying to fit in rather than just doing the damn work I needed done. And there were comments that were made to him. He's an African-American male. He was asked, how does it feel to be driving Miss Daisy? I'm going to beat you until you submit. And I wasn't in the room to hear it, but he came to me and he said, and you've got to go fix that because you're my boss. And so I go and I don't even remember how the conversation started, but ultimately it was something along the lines of, you said something that was offensive to this person on our team. And she immediately was offended that they were offended. But we talked it through, and I understood the driving Miss Daisy is a Southern thing, but you can't say that. Like I can't say powwow. She ended up crying and leaving the space. But now she's like taking every single implicit association test out there. She is like, like a ridiculously inclusive leader. Like she is constantly bringing up, someone's voice is not in this room. There's not a woman in this space. We need the voice of the administrative staff if we're going to be making these decisions. We need the voice, we need an African-American president in this room if we're going to be making these decisions. So that calling in, which is what I like to call it, rather than calling out, seemed to help. So I think the approach is to try to find a way to call them in, to do it with a sense of empathy and understanding that we are all subject to the programming that happens in the world that we live in. And unless you think they were doing it consciously and explicitly, I say try to call them in a heartfelt way. That even requires us to be people-centered.
I'm glad you mentioned microaggressions. We had a great question in the chat in terms of replacing microaggressions with micro approvals. And so can you give us some examples of what micro approvals look like?
Absolutely. So sometimes it doesn't happen very often anymore because people know better. But people used to, sometimes I'll wear my hair like this, and sometimes as you'll see in the picture, I'll wear my hair in braids. And I would often get comments about my braids that weren't necessarily just nice hair or nice braids or nice haircut. But I have a colleague, or had a colleague who we were in a space once and someone said something about my braids that was a bit of a microaggression, could have been received as a microaggression. And I didn't say anything in that moment. And she immediately popped up and said, I think that your braids are absolutely beautiful. I think that there are a lot of times where I wish I could do my hair in braids in that same way. And that was a micro affirmation to me, recognizing the beauty in my hairstyle, and a hairstyle that we've had to pass federal laws around allowing me to wear to work, or state laws. We're almost at a federal law, the Crown Act. Like we've had to pass laws that allow me to wear my hair that way. So that's a micro affirmation. Honestly, some of these stories make me want to cry. Recently, I was in a space where I was the only Black woman in the room, and we were talking about creating an infographic. And a white male said, can we make the person getting vaccinated a Black person? We need to center unrepresented voices. He didn't say that part, but that's what I got from it. I mean, part of it is that's some of it. Like, if we don't see us getting vaccinated in that way, we're not going to trust it. We don't see us in the materials that are being produced. And honestly, this whole idea of, and I know I'm digressing from the question, but this whole idea of African Americans getting vaccinated first that was floating around. Do you remember that, Isla? Did you remember that? They were talking about vulnerable populations and Black folks should get vaccinated first. And I had a lot of friends and colleagues call me, or friends and family call me and say, well, we never get anything good first. Why would they be giving this to us if it's good? Mm-hmm. Like, that's a literal question.
Yeah.
But from a public health perspective, we need the most vulnerable populations, for whatever reason, to be vaccinated first. So we've got to solve these public health problems on the back end, or we're going to run into the same problem with the next pandemic. It's not going to change. I don't know if I answered the question. I digressed. My apologies.
Everything you shared was wonderful.
The other thing on microaggressions, I'll say real quick, one of my favorite things to say is ouch. Just ouch, ouch. And then they'll ask, what? That's permission to me to tell them.
Oh, that's really good.
I do that. Yeah, I do that pretty regularly. Ouch.
There's a question about, I want to read it so I can summarize it. Thoughts, accumulation of bias in the context of Coal Run. So a pattern between racial systematic issues like the water supply being ignored, and then the behaviors and actions of individual Black Americans being spotlighted. Do you have any thoughts on why this might be? Is it the accumulation of bias related here, perhaps?
I don't know how to answer that question. Accumulation of bias. Well, I mean, for 50 years, they tried to work with varying county commissioners and no one would give them access to public water. They went to the health department and health department said, dig a well. And I think that because of the way the water lines were kind of literally in Coal Run, but they couldn't get access to them. And the language that was in the record from the county commissioner, you won't get clean water until President Bush drops fire bombs. You'll be lucky. Your great-great-grandchildren will be lucky if you get clean water. That language, I think, kind of impacted, and the fact that it was a majority Black community. I don't know. I'm not sure accumulation of bias. I'm not sure about that.
So here's another thing that has been on my mind during your talk. So not all of us are Black. We'll never understand these lived experiences. Many of us are coming from things and experiences and identities that, we do feel, whether it's immigrant kid, Muslim American, tribal member, Native American, all of these pieces, sexual orientation, gender identity. So I'm wondering, first, what do you think kind of ties discrimination, racism, xenophobia together in terms of these experiences? And what do you think, or what can you speak to that you feel is uniquely an experience for Black people in this country?
It's a loaded question.
It's a lot.
Let's try that first one again. Say that to me one more time.
So, is there a commonality between experience of being the recipient of bias or racism or xenophobia or Islamophobia, either in terms of the experience or the structures that perpetuate it?
I'm gonna tell you, let me just say, immediately for me, the implicit bias hurts worse. The implicit bias is heartbreaking. If you're overtly racist against me, there are some legal routes I can take to fix that. It's the implicit, it's the unconscious that hurts the most, because when you try to tell somebody, when I try to explain to people, yeah, but you're talking to me about this book and you haven't talked to any of the white men who have done that. And then they're like, yeah, but we're still gonna talk to you about it. Or the response may be something like, this is a totally different situation. When you can see the only thing different about the situation is that I'm a Black woman. This is an element of gaslighting. It's an element of I think that the second part of your question, the immediate thing that came to mind to me in response to that is, believe me when I tell you what I'm experiencing. Don't try to see me through your eyes. Try to see me through my eyes. Listen to what I'm saying. If I'm saying that thing felt offensive, it shouldn't take a statement if I say that it's offensive to me, believe me. Believe me. I know how to, back to the first question, I know how to stay away from racists. I know how to stay away from white supremacists. I know how to stay away from them. But it's hard to stay away from the well-meaning person, whatever race they are, who doesn't acknowledge their implicit bias. And that hurts.
We've only got a few more minutes left. If you're anything like me, after a presentation or a class, I'm like, I should have said these 12 things, and I lose sleep about it. So anything you might want to add or share before?
I haven't had that reflection time yet to see what I missed. Let me see. What did I miss? I will say, I want to leave with the words that I want to encourage each of you to be an intentional creator of belonging. For me personally, I pretty much have always been the only African-American person in the room from the time I was 8 years old at Girl Scout camp until I left CDC. But I always, even when I didn't feel like I belonged, I always looked for the person who also looked like maybe they didn't feel like they belonged either. And I tried to bring them along with me. I truly believe that you can build your sense of belonging by having the courage to build a culture of belonging and a space for belonging for everybody else. And there's a fine line there because nobody wants to be tokenized or othered or anything like that. But we all have a diversity story, and we all yearn for a sense of belonging, all of us. And so that's one of the reasons why I like to talk about diversity and inclusion through this lens, because we all need this, every single one of us. And I think all of us can think about a moment where we didn't feel like we belonged. What that feels like, what that does to our psyche, what it does to our self-esteem, to our motivation. And so I just want to make sure I leave with the words that I want to encourage you to have the courage to be intentional creators of belonging.
I think this is a perfect way to end this program. Montrese, thank you so much for being here, being so generous with your time and your experiences. I feel like I can go into my work and all of our work with more intention and understanding. So folks, thanks so much for joining, and we are looking forward to seeing you at our next OCH event. Thanks all.